Hello dentists, today we're going to talk about the canine. Especially we're going to talk about the maxillary canine. Okay, the canine is located as the third tooth from the center or the midline. Okay, we have here, this is the midline, and we have, this is the central incisor, and then we have the lateral, and this is the third tooth, which is the canine. It is a sharp tooth with a single point or cusp designed for tearing or piercing of food. The canine is also called the eye tooth, so it is called the eye tooth. We have two maxillary canines. Okay, we have two maxillary canines, and we have two mandibular canines. So these are the two mandibular canines. Okay, the canines have also a crown, neck, and a crown, neck, and roots. Okay, let's look here. So this is the maxillary canine. This is the left one. Okay, this is the left side. Okay, so this is the left canine. Here we have, this is the crown. We have a crown, and then we have the neck, and this is the root. Okay, and the crown, it's made up of a very thin layer called enamel, and which covers the dentine, and then the dentine covers the pulp cavity. Okay, so let's look at the labial aspect. Okay, labial aspect of the canine. So the labial aspect of the crown is smooth with no developmental lines except the shallow depression mesially. This is mesially, and this is distal side. This is the medial side, and this is the distal side. Okay, we have here depressions dividing the labial surface to three lobes. So we have 1, 2, 3, 3 lobes. The middle lobe is greater than the others. This produces a ridge on the labial surface of the crown. Okay. The cervical line labially is convex. As we can see here, this is the cervical line, is convex towards the root portion. It is convex towards the root portion. Okay. The mesial surface is flatter. So this is the mesial surface. It is flatter, okay, flatter than the distal surface. The distal surface is highly convex. It is highly convex. So the mesial surface is flatter than the distal surface, and the distal surface is highly convex. A slight depression or concavity evident between the cervical line and the distal contact area. So this is the distal contact area. The mesial half of the crown makes contact with the lateral incisor, and the distal half of the contacts with the first premolar. So the contact areas are at different levels cervico-incisally. Okay. The mesial crest of the curvature or the contact area is at the junction of the incisal and middle 1/3. The distal crest of the curvature in the center of the midline 1/3. The mesio-incisal angle is sharper. So this is the mesio-incisal angle. It is sharper than the disto-incisal angle. So this is the mesio-incisal angle, it is sharper than the disto-incisal angle. So today we talked about the anatomy of the upper maxillary canine. Thank you for listening. Goodbye for now.